Hello everyone, welcome back to my channel Nourish Nector. Today we are going to discuss about dissection tools. Basically, we have number of tools used for dissection, but not all are that much necessary, but some are necessary tools which are sure to be present in dissection table. First most important tool in dissection is scalpel, which contain blade that is very sharp and used for cutting the tissues and especially upper surface of skin. So dissection start with scalpel, but generally we avoid the dissection of internal parts of our body in order to avoid the damage. And there are different type of forceps we use in dissection. They are tooth forceps, pointed forceps and blunt or plain forceps. So the first one, which is tooth forceps, is generally used for holding the muscles during dissection. Next one is the pointed forceps. The pointed forceps one generally used for holding any kind of nerve or artery or vein during the process of dissection. And the other type is the blunt forceps, which is used for the organs or holding the muscles and the cartilage. Mainly, these forceps are used in the process of dissection to avoid any kind of damage. So, whenever during the dissection we are supposed to use scalpel as our regular hand, we should avoid it by using the forceps. Now, let's discuss about scissors. Basically, there are two type of scissors. One is straight away, that is scissors which is used to cut tissues or skin of superficial surface. And the other one is slightly curved, which is to cut the internal organs like uterus and other organs. Also, we can use needles for clearing the part during the dissection. And also measuring tape is used to measure the organs like example small intestine. So if you find this video useful, please like, share and subscribe my channel. Thank you.